Hello, everyone. We're going to get started in just a moment, giving just a few more seconds for people to join the webinar. Okay, thank you, everyone. I'm going to get started because we have a packed agenda today. My name is Olivia Velez. I'm Chief Digital Health Officer at IntraHealth International, and I'm also one of the co-chairs of the Global Digital Health Network. We want to thank you for joining today's webinar and for being a part of our community. So welcome to the session, which is called AIM Health Plus, a digital journey towards strengthening community health worker programming. And I'm going to turn it over to Loria to get started.
Thanks so much, Olivia. My name is Loria Kulasangam. I'm one of the moderators for today's webinar, and I'm Knowledge Management and Capability Advisor with Health and Nutrition at World Vision International. And I'll introduce our second moderator who will be moderating our panel later on in the call. But just give me 1 minute here. First of all, I'll just do a quick summary of what we'll be talking about today. The first part of the webinar today will be about introducing AIM Health Plus, so you know more about the program and the digital health key findings. And then secondly, we're going to have a question and answer panel featuring World Vision and Ministry of Health representatives from both Sierra Leone and Uganda. And we're so thrilled to have them with us today. So now I'll introduce the moderators and our first speaker. So Andrew Ogongo will be moderating the panel. He has, but actually I'll introduce Annette first, sorry about that. And I'll introduce Andrew when, just a little bit later when the panel is happening. So we're so pleased to have Annette to introduce AIM Health Plus and the digital findings. She's the evidence building contractor with World Vision International, and her formal training is in social and behavioral epidemiology. And she's carried out monitoring and evaluation efforts for over 15 years. Previously, she served as a technical director for research and monitoring and evaluation, supporting World Vision's health, nutrition, and WASH programs for over a decade. And in 2018, she started working as a contractor with World Vision's Digital for Development and Innovation team. And she led the team that produced the AIM Health Plus digital health brief that we will hear about today. And I'm going to turn it over to her right now.
Thanks, Loria. Let's get this show started. First, let me introduce to you the AIM Health Plus program briefly, which is the home where the digital activities that we're going to hear about today. The program was actually the second phase of this program grant funded by the Irish Aid. Ended just recently in December of 2022. It had the aims of addressing maternal and child mortality, and had some specific objectives with a focus on enhancing maternal, newborn, child health services, as well as addressing the governance and partnership structures. And when the grant was updated in 2017, a fifth objective was added to focus on using digital technology to enhance these outcomes. Next slide. The package of interventions that were deployed under AIM Health included a very strong community health worker enhancement program. The digital tool was designed to enhance that component. And you can see on the left here, the voice of one of these community health workers from Mauritania, applauding the benefits of using the digital tool. What the tool was intended to do was help the CHWs remember their visit schedules. It supported local language and contextualization for not only the data fields, but also for images and audio clips. It supported the CHW when they were conducting their counseling session, hopefully enhancing the quality of that interaction. And it allowed for near real-time reporting of data to Ministry of Health partners, most importantly, the people that the CHWs were directly working with in the health facilities, and also those who are making longer term decisions about the CHW programming. Next slide. So now shifting gears to the evidence review that we conducted, which is the focus of the digital health brief. We relied almost exclusively on pre-existing information, with the exception of some group interviews that we conducted directly. The timeline here is just to highlight that the deployments did not happen at the same time. So both Sierra Leone and Uganda had earlier dates for deploying the technology in the field than did Mauritania and Tanzania, which is one of the reasons why we're featuring those two countries on this call. Next slide. Just briefly, I want to share a few of the results that are featured in the brief. This first slide is about the core functionalities of the digital tool. We've grouped them into core case management functionalities and behavior change functionalities. So what you can see here is that all countries appreciated that first feature of putting information into the phone or data entry. But when we get to the second and third feature here on the graph, the reminder system and the communication with clinics were more appreciated in Sierra Leone than any of the other countries. And then on the right-hand side, the last two sets of bars, the behavior change communication functionalities were considerably more appreciated in Mauritania and Uganda than the other two countries. Next slide. We also looked at some information about what the clients of community health workers saw as the merits of the digital tool. And in this graph, you can see that in Mauritania in general, we had fairly strong ratings at around 65% or above across these three domains of information sharing, referrals, and trust as merits of the digital tool. Sierra Leone stands out again in this data because it has considerably higher ratings across all three of those domains. Tanzania and Uganda had similar ratings generally at or above 60% across all three domains. Next slide. And finally, I'm going to feature the association between the use of the digital tool and health outcomes. So in the blue bars, you have 3 shades of blue indicating no exposure of the CHW client to no exposure of the client to a CHW using the digital tool, moderate exposure to a CHW using the digital tool, and high exposure. So there's a gradient here across those blue bars, and the pattern we were hoping to see is clearly shown for Mauritania and Sierra Leone, where the positive health outcome is increased as you look across the levels of exposure to the digital tool. So the highest level of exposure to the digital tool is where you see the most positive health outcomes. First, when we interpret these data, we have to remember that this is all this information is collected at the same point in time. So we're not able to sort of tease apart the sequence of exposure to the digital tool from the outcome. So this is not cannot be interpreted as causal in nature. We see the most consistent evidence for the link between improvements in complete childhood vaccination and skilled birth attendance, and for Mauritania and Sierra Leone. In Tanzania, there is not statistically significant association here between the exposure to the tool and the outcomes, but you can see a tendency towards improvement with increased exposure. In Uganda, the pattern reverses. And they speculated that this is due to limitations in replacing devices or possibly suspicion of the technology over time as the project was drawing to a close. Next slide. We're going to wrap up here with just a little bit of an introduction to the lessons learned and recommendations. We gathered that information across all of these different topics. But next slide, we also organized it to link together the lessons learned with the recommendations. Next slide. And you can see here that just featuring a couple of the topics that are linked to our panel discussion here. In the lessons learned, we looked at the value of digital health programming and saw that it was most visible when data quality improvement was observed. And it was challenging to demonstrate a contribution to health and nutrition outcomes. And the recommendations here are to partner to create a shared vision for digital return on investment and for sustainability, to consolidate and share robust M&E insights. Under the interoperability domain, in terms of stumbling blocks, the teams learned that there was an unclear commitment to community health data streams, and that aligning data collection to country and local needs was a challenge and important. And the recommendations are to focus on more on advocacy to increase the perception of the value of community health data streams specifically, and to assess indicator and data alignment early on at the design or at the early deployment stage, and to address data security. So this gives you a flavor of the lessons learned and recommendations that are included in the brief. Next slide. So I'm going to stop there and ask you to download the full brief, and so you can get a full idea of the range of information we've gathered together there. And now I'll stop there and hand it back over to Loria. Thank you.
Thanks so much, Annette. So we're going to go into our panel now, and I'll introduce Andrew Ogongo, who is our Senior Program Manager, Digital for Development and Innovation with World Vision International. He's moderating the panel, and he has over 2 decades of experience in designing and implementing digital for development solutions in support of development work and humanitarian relief. And so he'll be leading the panel, and I'm just going to introduce our panelists. We'll start. So just give me one moment here. We'll start with Safa Andrew Koroma. He's the Technical Health and Nutrition Program Manager with World Vision Sierra Leone. He provides overall management and high-level technical support to the health and nutrition sector and focuses on maternal, newborn, and child health. And he contributes to the overall health strategy development for World Vision Sierra Leone in close collaboration with the Ministry of Health and Sanitation, and serves as a country lead for all health and nutrition programs in World Vision Sierra Leone. He has over 15 years of a diverse work experience with a strong background in community health, strategic planning, health system strengthening, and building of maternal newborn child health programs at community levels, and has led large teams on complex health projects in conflict and post-conflict environments. Next, we have Benon Musazizi. He's a technical program manager for health and nutrition with World Vision Uganda. He's a public health and nutrition management specialist with over 17 years of experience with local and international NGOs. And he provides overall country office technical leadership and guides the strategy and health and nutrition program execution, monitoring, reporting, planning, and partnership processes. And we're glad that both of them could be with us. And we're so pleased to also welcome partners from our Ministry of Health in both countries. We have Dr. Prince Masuba. Dr. Masuba completed his medical training in 2006 and earned his Master of International Public Health degree from University of Sydney in 2014. When he returned to Sierra Leone, he served as head of Kanama Government Hospital for 3 years and transitioned to District Medical Office of Bonte District, where he built a wonderful working relationship with World Vision under the AIM Health Plus program. Recently, he's moved to Bo to serve as the District Medical Officer and continues the hard work to improve service delivery to the most needy. And we also have Sister Bena Nanyama. She's the Assistant District Health Officer with Maternal Newborn Child and Adolescent Health and Nursing, Busia District, Uganda. She's a health management specialist with over 20 years of experience working with health facilities and district level governments. And in her current role, she assists the district health office in quality assurance of all nursing services and in ensuring efficient, effective, high quality and affordable delivery of maternal child health that serves a population of the Busia district. We're so pleased to have all of you with us today for our panel, and I'll turn it over to Andrew right now to go ahead to start the panel.
Thank you, Gloria, for the introduction. Just before we start engaging with the panel discussion, I just want to go through a citation. A weak health system, poor infrastructure, and varied social cultural factors are cited as inhibitors to optimal health system performance and improved maternal and child health status. Digital health intervention has become a major solution to closing these gaps in healthcare delivery in low and middle income countries. And that's basically what the AIM Health Plus is trying to address in the 4 countries where World Vision has been working in. I take also this chance to welcome my panelists, and we have some questions which are all have got a theme which already been shared with Annette, and we're happy to start going through that. Now, the first question will go to Safa and Dr. Mayumba from Sierra Leone team. Over the course of the AIM Health Plus project, what were the key action or events that helped to build the partnership between World Vision and the Ministry of Health? So some of the keywords are, what are the key action or events that help to build the partnership between World Vision and Ministry of Health based on the course of AIM Health Plus project? We could start with the SAFA, and what we really need is to ensure that SAFA should be able to give a perspective based in World Vision perspective, and Dr. Masumba should give it based on the Ministry of Health perspective. Over to SAFA.
Thank you very much, Andrew, and good afternoon, good morning, good evening to everyone. Andrew, I think I will start by saying that one of the major things was like involvement of Ministry of Health in the initial phase of the design of the project, and ensuring that they were part of every step as we moved along with the project, which means once the project was designed, they were part of the entire process in ensuring that the project is being implemented. The next thing I would like to talk about is coordination. Coordination was very, very strong between the Ministry of Health and World Vision International Sierra Leone. So we coordinated very well along every path, which included at both the district level and at the national level. to be able to ensure that what was designed for the project is really as also linked to the Ministry of Health context in terms of programmatic actions in Sierra Leone. And also transparency, accountability. So once you work with your partner, there is very strong to be able to be transparent with them. So transparency, accountability between us and the Ministry of Health was very, very strong as we moved along into the entire project. And we ensured that they were totally integrated into the entire actions as we moved along. So which includes even the supportive supervisions, they were part of it, part of the planning and ensuring that we work together. So we had to work together at every step of the intervention to be able to ensure that we reach where we were able to reach at that point. Maybe I will just pass them to Dr. Masuba to be able to talk about the perspective from the Ministry of Health.
Thank you very much. Good afternoon. I'm Dr. Masuba. I want to believe it's very similar, but for the Ministry of Health and World Vision AIM project, what helped the partnership? One was alignment with our strategic goals, because if we have to work with a partner, you have to align your goals with the Ministry of Health goals. Two, of course, mutual trust and transparency in working together. And three, of course, doing joint supervisions to ensure that the projects we put down succeed, that we do supervise those projects together. So if the AIM Health was well aligned with our project strategy, with our ministry strategic goals, they always informed us, they shared their plan, we shared opinions, and when we went to the field, we did our joint supervisions together. We were working with them, and there could always be challenges in any program, but we were able to work and make sure health service delivery in our facilities were excellent. They also gave us a lot of administrative support, like maintenance of facilities and supporting administrative operations, provision of course, in one district, provision of transportation for supervision, and we shared a lot of common goals. So our annual work plan, which we plan for in the ministry, is something we invite all partners, because we do not want when you start to work and then you start to do something. So we were always invited with our annual work plan until finish, and we had to share most of these experiences together. That was one of the successes that led. Indeed, in training, there was a lot of support to us as a ministry in helping to train our CHWs, of course, to be efficient and to be able to connect with our health facilities for referral patients that needed emergency services. So we have to be very thankful to World Vision for the ability to work with us, and we applaud. We are still waiting. We still want to continue to work with AIM. If the AIM Health projects, should there be a new one?
Thank you so much for that response. What comes out clearly, there are normally events which would actually be able to build a strong partnership between two organizations. And we realize that partnership is key to sustainability of any digital intervention. And some of the key areas which have been covered by the two gentlemen, one of them was coordination between the partners, transparency and ensuring that all relevant partners are involved at the initial stage of the design stage of the project. That came out very clearly. So those are some of the takeaway we need to have as we also work towards also implementing similar digital intervention in our different countries where we're coming from. Thank you so much for that. Now, our next question will go to Uganda team, and that is Benon and Sister Bena. You would actually, any of you could start. The only difference here is you provide perspective based from the government side, and for Benan from the World Vision Uganda perspective. How did your learning related to the interoperability between CommCare and the existing government health management information system relate to the question of sustainability of digital health efforts? So let me just go through the same question again. How did your learning related to the interoperability, that is the ability for different application to share data across them between CommCare and the existing government health management information system relates to the question of sustainability of digital health efforts. Could we probably start with Benon?
Yeah, thank you, Andrew. And thank you, team, for organizing this engagement for us to share our experiences for AIM Health project. Basically, the project invested a lot in terms of building a system that is able to communicate to each other. So much as the partnership did not meet all the desired interoperability goals, we were able to, the project was able to create an opportunity to harness the indicators for the project and CommCare, and also make sure that all the indicators speak to our national health strategy. And that was very key, such that the CommCare indicators are aligned to national indicators. We're also able to generate a roadmap for CommCare DHIS2 information exchange. For example, the hosting of data in country by Ministry of Health, establishing a local team at Ministry of Health that is able to continue with the customization of CommCare, and of course the scale up beyond Busia project. In addition, there were a number of learnings from the AIM Health Plus project. The implementation informed our community health strategy. We have just commissioned our community health strategy, and digital health was key in this regard. Actually, World Vision had to present during the consultation processes on how we can implement community digital health. And that of course speaks a lot in terms of moving forward and scaling up the interventions that we're building on the lessons learned from Busia. So in addition, the district teams were empowered to access data from the platforms at subnational level for decision making, but also at different levels of service delivery to make decisions, including at community level, where VHTs were able to make decisions based on data that was coming in and analyzed. But by and large, we need to invest a lot in terms of advocacy. Digital health programming is a new innovation in country. So we need to continue building our infrastructure, building our human resource capacity for our systems to appreciate digital health programming. Thank you, Andrew.
Okay, thanks so much. Sister Bena, you have something to share?
Thank you very much. I think all Benon has almost mentioned everything since we have been together, but I only appreciate very much that AIM Health really encouraged the district teams to actually access data, which has helped us to make decisions and inform our planning processes in the district, right from the higher office up to the parish levels. The other thing, I just also want to thank Benon for mentioning almost everything. And I want to agree with him that that's what we had.
Okay.
Thank you.
Well, thanks so much for that response. I think some of the key indicators, the key takeaway from this particular question regarding interoperability between CommCare and the existing government management information system comes from realize the need to align the indicators with the government ones. That's very important, like what happened in Uganda. And so the next thing, there was a committee that was formed to work at harmonizing the indicators from CommCare as well as from the government side to ensure that that data that will be automatically be sent from CommCare to the government system meets their requirements. So those are key things which are very important. And also you find that a good working relationship between World Vision Uganda and Uganda government makes sure that when the government was coming up with the national digital strategy, the input into that process, that means how much the partner actually value them in terms of that. So those are some of the key things that we really need to take away with us from that particular question. So when we are going to the third one, in this third one, all the two teams will need to respond to it. And I'll start with the Sierra Leone team. Reflecting on the AIM Health Plus experience, when you think about strengthening community health system and the role of community health workers, how do you see investment in digital health fitting in this picture? I would want you to come out clearly with a bigger picture where you are involving universal health coverage as well as sustainable development goals of the UN when you are responding to this, so that our audience could really have the picture and what role strengthening of community health system would play in that particular aspect.
Thank you very much, Andrew. Just to say that the CommCare application that was set in the Sierra Leone ensure that we provide accurate and preventive and care-seeking information to create demand for services, empower families, and to improve health outcomes. And also it enables us to register pregnant women and children for relevant healthcare and program schedules, reminders and alerts about the next visit. Therefore, the impact of this helps to minimize time barriers and facilitate urgent care for during either obstetric referrals or children that are really, really sick. Linking this to the sustainable development goals, as we all are aware, that we want to see exactly where maternal and newborn child health is at the peak, and then ensuring that maternal deaths and child deaths are being addressed. So investing in CHW activities at this level, which actions are already taking place outside the health facilities. They are not happening in the health facilities, but rather, and it's also creating a very great impact outside the health facilities before even bringing it into the health facility. And therefore, investing along this path in terms of community health workers, it will ensure and create this impact that we have just talked about, to be able to ensure that decisions are made at real time, because the CHWs will ensure they provide real-time data for evidence decision-making. They ensure that the referrals are prompt. And once referrals are prompt, what we expect medical cares are prompt. For instance, when CHWs refer to health facility staffs, they have already informed the community health officer or in charge. The in charge knows exactly what type of patient is going to come to that facility. And so if they do not have the capacity, they have already planning to do a second line of referral. So investing in community health workers at the community level, it will definitely help to reduce the burden first at the health facility, because we have few health trained personnel at the health facility. Some of these things will be addressed by the community health workers, especially the ICCM actions at community level. So it reduces burden, it also increases trust, and also it is cheaper to invest, and then the impact of investment is high in terms of return on investment, because they are always part of the communities and they will be able to provide and link to services at that level, so that communities are able to take ownership of the actions, which will definitely reduce our health, the amount of money that will be spent on our health programs, rather than ensuring that the CHWs are there, and then they will address most of these things that you will have to spend on equipment, infrastructure, and all of these things, because they will provide those services outside the health facilities. And then only the severe ones will come into the health facilities, thereby also providing a clear action at that level. I also want to submit to Dr. Masuba for his comment along that part.
Yes, thank you very much, Mr. Safa. On our own part, we are working very hard to introduce the universal health coverage the end of this year and next year, and working with the CHWs. We believe digital health will empower the CHWs to be able to do one, improve access to healthcare, two, being able to track down defaulters for immunization, and three, to bring high-risk cases, pregnant women, back to the facilities so that they can be attention and care will be optimized. These are the three things we have seen. Digital health that is translated in the local language, which is easy for the CHW and the patients to adopt, has in the areas where World Vision was operating, we had to see a lot of efficiency on the part of the CHWs that were deployed in those areas, as compared to areas where we didn't have the digital health opportunities. So the government is thinking about rolling out digital health and a form of CHW enhancement to health that will improve as we're moving from free healthcare now to universal health coverage, that will improve primary healthcare functions, reduce the amount of patients that are entering into the secondary healthcare, and also increase the efficiency of the secondary healthcare. So if we only invest money into CHWs, continuum of care for hypertension, diabetes, and most of these communicable and even non-communicable diseases, will be easy to reach out to our patients there. Apart from maternal health, neglected tropical disease and other diseases, these are areas where we believe there will be immense improvement in our in functions of the primary healthcare. And of course, the two things that we surely want to impact, infant and maternal mortality, which we are fighting to reduce for Sierra Leone. We believe if we empower pregnant women, like I said, for high-risk patients will be referred on early terms, that will reduce the need for even reduce the rate of C-sections, and of course, bringing appropriate care. Instead of referring them at a late time, that will allow early referral and early intervention. So we are all looking forward to this investment from the government. The government is planning universal health coverage as we head into 2024, effectively to reduce the burden of cost on our patients, to reduce out-of-pocket payments, and we believe this is the need for digital healthcare.
Thank you so much for that response. Could we go to Uganda team?
I think Sister Bena will go first.
Okay. Thank you very much. According to Sierra District and the Ministry of Health, am I being heard?
Yes,
are you hearing?
We can hear you, clear.
Oh, okay. Thank you very much. Under this, we are saying, as we see a district and MOH in Uganda, we are saying that district health teams are looking forward using this digital tool through reporting a lot of things from the community. And that is, if the DHTs can actually embrace this tool, it will give us good information. For example, information from households about poverty levels, how many numbers of PWDs, who are key populations. Then we are also looking at how many households are having actually local crops to support the nutrition issues in our country and our district at large. We are also saying it is worth investing in digital health tools because many gaps can be identified there and then. Because when the community health worker has a phone and he reports some of the issues, you discover that there are some gaps which are identified there and then, and they are rectified immediately. Then also we are saying that data collected by these VHTs will actually be a tool to analyze the needs of the community, and at the same time, in turn, it will inform programming and the planning process in both the district and in the country. I pass the rest to Benon.
Yes, thank you, Sister Bena, for that information. Just to add to her submission, you realize that Uganda's goal for universal health coverage is to provide at least 65% of its population quality healthcare by 2030. And when you look at the available information is that we are only able to reach out to only 44% with quality healthcare. So reflecting on digital health programming in terms of quality of services. So digital health is able to enable the community health workers give reliable diagnosis of diseases such as malaria, diarrhea, and pneumonia. They are able to do efficient counseling and be able to communicate. It enables the communication between the community health worker and their clients. So that becomes very critical in terms of giving reliable information, but also the quality of diagnosis and the treatment at community level. Our colleagues have also talked about referrals. Digital health is able to facilitate quicker and faster referrals, especially addressing the 3 delays: the delay to make a decision at home, the delay to reach the health facilities because they are able to communicate with the service providers to enable the patients, the mothers or the children to reach the facility, but also the communication from the community for the health workers at the facility level to expect patients from the community. We have also been challenged quite often with the referrals, the counter referrals. While the VHTs do referrals to the facility, we don't have that counter referral. So digital health enables us to facilitate the counter referrals from the facility to the community, but also from the community to the facilities. We have also realized that in terms of reporting, there is timely reporting, but also we are able to utilize digital health for performance-based pay for community health workers moving forward. We have tried out this with our Pfizer project in Bujiri, and it's working very well in terms of paying those VHTs that have reported and are doing work. In terms of motivation, because you realize for us to reach out to the communities, to reach out the last mile, we need a motivated community health system, and digital health enables VHTs to be motivated, having their phones, being able to communicate within the structure, so it fosters a motivated community workforce. And lastly, in terms of data privacy and security, it is better than what we have been using, the paperwork. So I think it is very critical that we invest in digital health, but also we need to do constant sensitization of the community to embrace digital health transformation. Thank you, Andrew.
Okay, well, thanks a lot for all the response, which really tying well what is the purpose, why we should actually have community health system strengthened and the role of community health workers, and compare that one also to the digital health fitting into the bigger picture. I think some of the key things you come up with was investment in community health workers, facilitate quicker referral of cases, and also quicker ways of handling cases which could actually be handled at community level than the ones which actually refer to the hospital. Something also which came out also from your feedback, which is very important, is reporting data to the government system. I think that's very key. And also you mentioned about the timeline for the government to have quality health care covered for their population. Currently, like a case for Uganda is only 44%. So by training community health workers, what it does, it will complement the government effort. And so the areas which already there's community health worker would actually be able to support the government initiative in terms of increasing this percentage to cover the universal health coverage. So I see that's quite good. And also universal health care in all country offices by the community health workers supplementing the government effort, they'll make it be able to realize much faster. So those are some of the takeaway I think I captured from your response from question number 3. I think I would hand over to Gloria, the next section.
Thanks, Andrew. we've got a time of question and answer right now, so we'd encourage people to put their Q&A questions into the chat, and into the question and answer tab, and we can answer those questions now. There have been a lot of questions about community health workers. Some of those have been answered. I'm just looking to see if there's any unanswered questions, but one of the questions was about the motivators and what was done. And I'm wondering maybe if we could hear from both countries to just give one example of what was done to motivate their community health workers. And there wasn't a large turnover seen, so maybe we could hear one example. Andrew, does that?
Yes, yeah, that's quite right. I think Uganda team talk about how they were motivating community health workers. So probably they could tell us how they were motivating community health workers to ensure that they're able to deliver on their work as expected. And I think the same should also apply to the Sierra Leone team, especially SAFA probably also have got the way they were motivating their community health workers to ensure that they're able to deliver.
Great. Can we hear from you, Safa, and from the other team as well?
All right, so from Sierra Leone, thank you very much, Andrew. There are a lot of motivation for community health workers. First, we let them understand that we brought dignity to them, let them understand that they are part of the process. First of all, being part of the entire process, ensuring that we are together and we are working together and we have to meet together, which creates a dignity within them. Secondly, we ensured that they are provided with basic tools that they need. For example, bicycles, in terms of them to be able to move to some locations. They have bicycles. We provide them backpacks, provide them rain gears during the rainy season, making the work very enticing. And after every quarter, we also used to provide them certification, ensuring that we award the best community health worker. Depends on how many referrals did you make, how many homes did you visit, what are some of the innovations you created during those processes. And so we provided them certificates, have them be part of the entire process and ensure that yes, they are also contributing to the actions as well. Provided them, apart from the mobile phones, provided them data, provided them mobile charge cards to be able to use even they're at different locations outside their homes, they're able to communicate. Thirdly, we were able to ensure that we worked with them to have the adult literacy programming, where they were trained on numeracy and also financial management, and build up savings for transformation among them so that they are able to ensure that they have something for economic empowerment, even when they are not being paid as regular staffs into some of these things. So they are able to raise some funds through the savings for transformation actions that we also created along that path as well, that made them really, really understand that, yes, they are part of the process and they should be able to provide as much as they can to be able to save lives. Maybe Dr. Masuba will want to add something.
Oh, Mr. Safa, you've almost said everything for the empowerment and motivation. Well, we provided some small incentives monthly to support their families, of course, but most of the things he said is right. A phone to be able to connect with other people and continue to do the services, rucksack to put all your belongings if you want to travel between towns, and of course, education. Sometimes even continuing education, they are provided with adult literacy skills. The new set of community health workers we have even deployed, we made it a rule, if you do not pass your basic that's the West African basic exams here, you will not be chosen, because we are now heading into continuum of care. There will be a lot of teaching, there will be a lot of knowledge impacted into the community healthcare workers. Like, for instance, if we diagnose hypertension, we have to continue treatment even in their villages. And this was the need. They were there to support other services, you see. So this phase of community healthcare workers, the training, the empowerment through training, the certification and the stuff, Mr. Safa rightly said, that's what we did to actually empower most of our, and recognition. Community healthcare workers were not only people, we saw people who were interested in those communities, people who wanted to contribute to health, and that was the way, the criteria to choose them, you see. So it made them important, it made them recognized. I think that's what I would say about Mr. Safa. You just said everything.
Thank you very much. Back to you, Andrew.
Thank you so much. Could we hear from Uganda team? if you just probably, if some of the points already covered by Sierra Leone, you don't need to repeat, but.
Yeah, I think Sierra Leone has spoken to a number of issues, but maybe just give them a context. I know Sister Benna will have to speak a lot. The selection by the community members, selecting them to be community health workers by the community itself, that was motivation a lot for them to perform their duty. But also we invested a lot in building their capacity. A capacity in terms of training, support, supervision, mentorship for them to use the phone. So they felt comfortable doing their work with a lot of capacity and the communities believing them. We also did a lot of recognition, appreciating their work, supporting them with bags for them to move with their materials to the community. We gave them transport, the bicycles. So in terms of moving to the community, but also doing their own work, they were able, that motivated them a lot. We also gave them funds. We support them with funds and data for them to be able to report. That was a key motivation, in addition to the routine reflection meetings that happened in the community and engaging with the health workers. Because you know, initially we had a disconnect between community and health facility, and this kind of arrangement, since we're doing a system strengthening approach, we were able to connect the facility and the community. So the VHTs felt motivated when they got support supervision from the district health teams and the health workers. So I think Sister Benna can add to that if they have any.
You need to unmute.
Sister Benna, you're muted.
Okay, from the very beginning, I was saying, in addition to what Benoni has said, in our district, in the very beginning, we owned these VHTs or community health workers. Wherever we go, we have to recognize them, because every function that happens in a community, we begin with them, because without them, we can't get data in the district. Two, also, we have always conducted what we call monthly meetings and quarterly meetings. And whenever we go in those quarterly meetings, VHT can be recognized by a big person. For example, in Uganda, we have the LC5, we have the RDC, we have the DHO, we have the ADHO. When there is a handshake, and a word of saying, thank you very much, you are the best person, it also made them to feel that they are part of this system and they should continue. Also in the community, when World Vision, actually, I have to mention this, I'm very, very grateful to World Vision for what they did. For example, giving us the umbrellas, camp boots, to give those VHTs and those coats, which actually aligned them to be uniformed, and they call them health workers. And now they actually differentiated themselves from the community. It empowered them really to do their work, collect data, and send it immediately. And in that, they were even competing. Who is sending faster? Who is doing this? So that at least at the end of the day, you get a certificate of merit. So we are also saying these people also in collecting data, when we call them for training, we also inform them that you are now a health worker, a community health worker. Move from one house to another, and give us what we call accurate data. We don't want you to reach on the way and you falsify data and you bring it to us. It helps us to get accurate data because of actually praising them. Most of the things Benon has talked about them, but the rest, Sierra Leone has mentioned, but for us, we have owned our VHTs and we are still working with them and are very, very important. And I want to appreciate very much that digital health, That tool is going to support Busia as a district, and we want to cascade it to other districts in this country, and probably maybe to other countries in Africa, because for us in Busia, we have seen it work, and we are working with the community health workers very well. Thank you very much.
Thanks so much for that response and feedback.
Andrew, we're probably at time for questions. A number of questions have been already answered in the chat and in the Q&A channel. There was a question about sustainability, who will take ownership of these online health systems, and what are the future plans and protection mechanisms for the data. Annette did address that in the chat, but maybe as you wrap up, you could just briefly mention the sustainability aspect, and then we've got 4 minutes left, so we're going to give you time to quickly wrap up, and then we'll hear from the Global Digital Health Network to close us off. Thank you.
Okay, yeah. No, thank you so much, the panelists. One thing for joining us at this webinar, and also coming out clearly on some of the areas that's really very important for the implementation of digital intervention. And some of the areas which come out clearly, which actually formed the basis of the theme, is partnership. And I think you come clearly, what are some of the factors that need to be put in to come up with efficient and strong partnership. And also, you also came out and supported the idea of sustainability. How do we make the digital intervention sustainable? What are some of the things that need to be done? And you came out very clearly on that aspect as well. And strengthening community health workers' capability in terms of ensuring that they have the skills as well as the tools to support their work. That's also very critical. And something also which you came out very clearly on was the alignment of the digital health investment with the global big picture. That is the universal health care coverage as well as the sustainable development goals. And in all the two teams, what actually you really emphasized was the need to work very closely with the government, because World Vision normally supports the government initiatives. It's really important that you really need to know what are the government strategy and how do you really, that support you are providing, how does it align well with the government initiative? That is the only way through which such kind of investment would be sustainable, because the government supports initiatives that support their priorities. And once you work very closely with the government, right from the inception of the project up to the end, it means that this project is very viable and would be able to be sustainable and scale up to the rest of the country. Like Sister Benas mentioned that they're really happy with the project which ended in Busia, and her desire is to have it replicated in other districts within Uganda, as well as even the rest of the country. That normally, that could actually demonstrate the appreciation of what actually the digital intervention contributed in terms of realizing their outcome. In terms of how are the data normally handled, that's very critical, because when you work with the government, different government have got different response to that. The other government would want that such kind of data to sit within the Ministry of Health data center. So what normally World Vision does is to facilitate, to ensure that the data center is well equipped to support this kind of initiatives. So that's one way. And the data normally belongs to World Vision, belongs to the government, because World Vision supports the government. So in terms of who owns the data actually belongs to the government. World Vision, in this particular respect, support the government initiative. So wherever the data is sitting, the government must have access right to see the data, because the government uses those data for their planning purposes. So it's really important that it is seen in that particular respect. And that's what World Vision has been working in all these countries. They ensure that the data belongs to the government, whether the data is put in the cloud or sitting within the government data center. That has been the way. And to make it sustainable is what actually we are covering under partnership. And under partnership means also it does not actually involve the government alone, but it also involves also how do you partner with mobile network operators within the country, because in doing that, it will reduce cost. for data transmission. So, and apart from that, it's also important that you also need to partner with other local NGOs who also shares similar values like yours. So that's very important, because that would what make a project more sustainable, because it will have a bigger funding base to keep it going, and also for scalability to cover the rest of the country. So those are some of the key things that normally need to be factored in. But the most important thing is to make sure that at the design phase of the project, make sure that all the stakeholders, the people you need to partner with, are brought on board, so that right from the inception up to the end, they are part of the decision-making process. So I would, in conclusion, I would thank all panelists for the work well done, and thank you so much. So I'll hand over to the GDHN to close.
All right, thank you everybody for joining our call today. The PowerPoint presentation, the recording will be available soon on the network, along with the digital health brief. If you're not already a member of the Global Digital Health Network, it's free to sign up. You can use the link here, or it's globaldigitalhealthnetwork.org. Thank you again to all the panelists today. This was a wonderful presentation, and it's great to see the work that's being done. And that'll close us out for this month, and we hope you join us for our next webinar. Bye.
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 Bye. Bye, everyone.
Bye, everyone.
Thanks, everyone. And thank you very much, panelists.
Yes,
Great job.
bye.
Thanks, everyone.